Hello, listeners, and welcome to Beyond the Mirror. This isn't just another podcast, it's a deep dive into the world of beauty, wellness, and longevity. Now, we're here to discuss what beauty really means beyond just appearances. We'll also talk about wellness, the habits and practices that keep us healthy, full of energy, and we'll explore the topic of longevity, looking at the science and realities of living a long, fulfilling life. So sit back, relax, and join us as we go beyond the mirror. Welcome, listeners. We are so excited to have you here today with us. I have a special guest with me, Tina Cassidy. She has been a registered nurse for how many years have you been a nurse?
26.
26 years. She is one of our nurses here at Elemental Aesthetics and Elemental Wellness and Longevity. And we're going to be talking today a little bit about lip filler. Now, you've been in this industry for quite a while.
Yeah, just a few years. I
About 3
started
years.
In 2020 and then became more trained and educated in 2021 and have kind of dove right in ever since.
That is awesome. And you are loving the idea of lips. And it does quite a few things for us as women. If you're born with lips that are kind of smaller and you want something a little bit more voluptuous and just to kind of give you that, pouty look and just, looks good with lipstick on. There's just so many things about having nice lips that helps us. And so one of those things is boosting our confidence. Tell me a little bit about that.
Yes, definitely. So I believe that filler definitely provides a boost in self-esteem and confidence. It provides our clientele with an immediate rejuvenating result, which satisfies our patient's need for that instant gratification. It definitely provides a fuller, more youthful, balanced appearance, and you can have great results with lip filler for a more contoured lip. The saying goes and holds true that when we look good, we feel good.
Absolutely. Now, there's certain people that do really well with lip filler, and then there's certain people that it is not for. So, who would not be a candidate for lip filler?
Yes. So there's definitely a lot to being a candidate typically, or somebody that would be a good choice for receiving filler. Almost anyone at any age that has outcome or realistic expectations for their outcomes can be a candidate. But ideally, we would like for them to have a good anatomical structures to support any lip augmentation or filler. Mid face cheek support is really important. The preauricular area, which is kind of in front of the ear on the face, you want to make sure that that area has a good support system. One that I could talk about in a little bit is the piriform aperture area, which is that little divot kind of next to our nose. Just basically, the entire lower third face structural support should be intact to help and to support those lips, meaning the jawline, the chin, the prejowl sulcus area. Having the support in all of these areas along with the technique helps to prevent things like a protruding duck lip or a heaviness in the lower face, which can increase our marionettes or jowling. We can thank gravity and not living on the moon for that.
Yeah, I was like, okay, so it sounds like the more youthful you are, the more structure you're going to have in place, right? And so when we
Yes.
wait till we're a little bit older or more mature to be doing things like, lip filler, that's when we kind of got to look at the structure of the face a little bit more
Right. And that's where
effectively.
definitely we would
Yeah.
tend to maybe kind of start supporting those areas in order to have a better outcome for
Yeah.
those lips. For sure.
Absolutely. I've had my cert since I was 2017, and my nursing instructor for filler had the duck lip.
Yeah.
Yeah, and I
Yeah.
was like, "Oh,
That's not
that's not
something that we typically want.
no, no." I was like, "That's not cute. I don't want that." So yeah, whatever we can do to really minimize and not have that happen and really look at that structure is very, very important. Tell me a little bit about hyaluronic acid and Hylenex, a little bit of the difference between the two.
Yeah, so when we choose to augment our lips with an HA filler, HA is a hyaluronic acid. These fillers come with a based gel filler substance that's naturally found in our bodies that retains moisture. It's found in things like the skin, the joints, the eyes, and it is used obviously for lip filler for volumizing and shaping. Um, so this product is hydrophilic. It pulls or attracts moisture or water from surrounding tissues and hydrates and enhances the lips with volume. These dermal fillers can be reversed or dissolved with a hyaluronidase, or the brand name is Hylenex, if complications were to arise. So, for instance, if we were to have avascular occlusion or a compression of a blood vessel or artery, when that occurs, we would want to dissolve that filler or reverse it, or even maybe just use a little bit when we have, say, like an unwanted bubble, per se, when maybe an injector deposited an amount of filler too superficially or too shallow. Another reason to use Hylenex to dissolve that would be like a Tyndall effect. Sometimes a bluish hue can occur
Mhm.
depending on the type of product that we use. Maybe it could have been improperly, again, placed too superficially. Sometimes the filler will migrate for whatever reason, and we would want to dissolve that upper shelf or ledge that migration can occur above the vermilion border there. Sometimes we just want to dissolve years of filler placement and start with a fresh palette. So those would all be reasons to use the hyaluronidase.
Mm, very interesting. Yeah. Have you ever had a significant time where that was needed?
I have never had to dissolve due to a complication. There have been times where I've seen filler, or maybe somebody has came in from another med spa, or a client has a little superficial bump or something that was unable to be massaged out, that I've placed just a little couple drops of Hylenex in and been
Mhm.
able to correct that for them.
Awesome.
Just something to be said about that. If we are going to use that product, typically part of the history, whenever assessing the client at the beginning of our consultation, is I would want to assess for an allergy,
Mhm.
not only to like the lidocaine potentially that's in the dermal filler product itself, but an allergy to wasps or even any other flying insects that would potentially be like a cross allergy sensitivity reaction, because the protein and the enzyme of the Hylenex um,
It's similar.
is similar in
Yeah.
that reversal agent. Yeah.
That is interesting. Thank you so much for clarifying. Tell me some reasons about who who would be a good candidate for.
Yeah. So people come in looking for lip filler for all kinds of reasons. Of course, most people would like to have more of that youthful appearance. Some of them are looking for different structures of the lip or a different shape of the lip, like they maybe are seeking that keyhole lip or more of a pouty effect. Some people just simply want some hydration to their lips, and they really are afraid of being overfilled and looking more of like the duck lip that has been described as earlier. Some changes occur with the aging population. Bone resorption occurs, so we lose some of that soft volume tissue, and oftentimes a lot of the pink show to the lip is no longer actually showing. So they come in and essentially would like for us to rebuild a lip for them.
Yeah.
Yeah,
Very, very cool.
and we can do all those
I
things.
know.
It's
It's
like
just
magic.
it's so like facial art and it is so fun to see clients that come in and they're like, "I just want, beautiful lips like my friend," and
Yeah,
or maybe another family member and then they leave with the beautiful lips that they wanted. So it's
right.
so instant gratification,
It is
to
instant
see
gratification.
the amazing. So we
Oh,
talked. Oh, go ahead.
Oh, I'm sorry. A lot of the aesthetic industry is currently shying away from that overfilled, protruding look and going for a much more natural, subtle enhancement, which is what we really strive for here, for sure,
Yeah.
at Elemental Aesthetics.
Yeah, we want you to look natural. Tell me, I think you touched a little bit on the candidates who, would be a good candidate for getting the lip filler. Do you have any additive? We can skip this part. Okay, so we're gonna edit that out.
Somebody who would not be a good candidate for lip filler would potentially be so, just for example, as the natural aging process occurs, filler over time can elongate the area between the nose and the lips. We really want a proportional lower third of our face, and some people may actually need a surgical consult for a potential lip lift to achieve proper correction, and filler may actually not be the answer for them.
Mm-hmm.
So that would be a
Yeah,
good example of somebody who's not possibly a candidate for
gotcha.
actual lip filler.
Yeah,
So,
and you mentioned pregnancy.
right.
Yeah.
So we like to err on the side of caution and with safety in mind. Filler is not recommended by the manufacturers until age 21 for some of them, but
Mm-hmm.
typically it's just kind of like a tattoo or a piercing. We do require that they're at least 18
Mm-hmm.
and then not pregnant, nursing, or breastfeeding,
Yes,
or actively
exactly.
trying to get
Yeah.
pregnant. Yeah.
Yeah, absolutely. Tell me a little bit, Tina, about how you choose what product for what client.
Yes, for sure. So, assessment is everything. So, looking at the anatomy, the shape of their lips, so I'll have them open their mouth and I'll look for vessels and feel for like pulsing arteries, noting any asymmetries or discolorations. All kinds of things during the assessment process helps me to determine what type of filler to use, like what product. And also, of course, what the client is coming in desiring. So, proper product placement and choice is so important. There are stiffer fillers out there with a what we would call a higher G prime. We typically don't use those for lips. We would place those in more appropriate areas in the face to achieve a certain effect. But again, striving for that natural looking smile and expression, we want the filler to be able to move. So the proper product is very important. Um, so sometimes, for example, in a more mature lip with more inversion or less show of that pink show, a more robust filler would maybe be reused to recreate that border. And then the client could come back to fill some of that lip, like the body, after it settles within about 2 to 4 weeks and it integrates into that lip tissue. I typically recommend that my clients come back in a few weeks to reassess them for any touch ups that they may be needing or wanting, or even over a few months to slowly build or layer different products over time and create their desired lip shape and size. But obviously, I don't really know until I get in there how a person's going to react to their filler placement or how their lips will actually take it.
Mm-hmm.
Yeah. So, with that being said, some of the more robust fillers would be the Allergan Juvederm products. Revance's RHA3. Galderma has the Restylane Define or even Refine for definition of a lip. Some of the soft products are Velour, RHA2, Restylane Kiss, or one of our favorites, Revanesse Versa or Versa Lips. And then you could even use a softer, smoother product like Volbella, Mertz Bellatero, or Redensity simply for hydration. Those softer fillers typically don't last as long,
Mm-hmm.
but they're also great for things around the mouth that are concerning to the patients or the clients, like their perioral lines or their smoker's lines.
So like a little bit of a twofer factor for them.
Yeah,
Yeah, like you could,
for
yeah.
sure.
And here, you want me to touch up this?
Right. And
Yeah.
and often when you're filling the lips, you don't even need to correct those lines around the mouth, which is
Right?
wonderful. Pulls them
Yeah.
right out.
Yeah, it's amazing.
One of the things that a lot of clients hate is that when they apply their lipstick, they have that like bleeding of their lipstick into the creases around their mouth.
Yeah,
So,
the little smoker line looking
yeah,
things. Yeah.
yeah.
Mm-hmm.
And so the more versatile fillers you can actually use not only in the lip but in those creases around the mouth.
Mm-hmm.
So that's wonderful.
That's amazing. So just all wonderful things to
All kinds of
consider,
things.
right? When you're, instead of just looking at it by price, you can look at it by what do you want to get done? And are there a couple of different things you can address while you're addressing one, you can address the other, which is really cool. So I know that a lot of times it comes down to technique, how you get the look that you get. And so tell me a little bit about some of the techniques that you really love and enjoy using.
Yes, there are so many techniques out there.
There are.
So most injectors will kind of adopt a combination of multiple techniques and maybe form their own out of that. But honestly, really depends individually on each client's situation, their structure, and what their desired outcome is. Traditional or more classic ways to fill lips are by defining the border and then kind of filling in the body with some injections that may be V-shaped or kind of like a chicken foot shaped
Yeah.
injection. You injectors know what I'm talking
Yeah.
about. More popular recently are the vertical injection struts, which kind of leave a little lollipop top at the border, the top of that vermilion border. And that helps to pull out for height or more vertical projection of the lip, less of a full lip or protruding lip, but more of a everted higher lip. A lot of people call that the Julie Horn technique from an injector who developed that. Excuse me. There is a Russian lip vertical injection, and those vary depending on product amount. It does use more pokes per se for a flatter lip and a more pronounced cupid bow. Some do claim that these type of injections can cause more potential migration at the border due to multiple injections. And again, that migration happens when product seeps out from the body of the lip, causing that ledge above the top. Those vertical injections can also potentially cause more bruising and swelling. One of the recent techniques that we were discussing earlier, I had shared with another injector here, Tabitha at Elemental, was one that I recently learned using Revenus Versa, and it is a 7-point technique. And the idea is to have less injection points and kind of move the needle around diagonally and reach different areas of the lip with one poke, each of those being the 7 points, adding a little dollop to the cupid's bow and kind of letting that spread down the vermilion border. And this technique actually uses a bent needle, which might be like off label per se. And these needles that go in these syringes are very dependable. We're not worried about them
No.
breaking or anything with that.
No.
But it really allows the injector to create a beautiful lip with less pokes. And Tabitha and I have both been trying it lately, and we're both really loving the results. We've
The
seen some
results are
beautiful
amazing.
results.
Yes. Yeah.
Yeah.
It gives it a whole different shape almost,
It
Yeah,
does.
it's really cool.
I like
And it
these.
feels quick.
It does feel quick.
I like the patient, the client has to really love that part that it's less pokes,
For sure.
Yeah.
That's going to be less swelling.
Yeah.
With technique, also, you can use the syringe that the actual filler comes in, and some of us were taught to backfill, which means placing the product into a smaller syringe, like an insulin syringe. And I actually learned that way and really like that because I have very small hands and I feel like I have more precision with that and I'm able to like manipulate the injections in the needle a little better.
I do feel like it gives you more control.
Yeah.
Definitely.
So
It is.
control and precision.
Yes, it is a very different type of administration
Mhm.
using a backfilled syringe.
Yeah. So
Yeah.
there's all kinds of techniques and like I said, a lot of us just kind of incorporate all different ones and
Yeah. Yeah.
develop
Until you
our own
find what you
style.
like. Yeah.
Exactly.
And then you're like, oh my gosh, this is amazing. I'm loving it. Yeah. Awesome. Are there more techniques that you want to share?
I mean, I think I touched on just a few. There's
Yeah.
there's a random one out there that I definitely have not tried. I don't know if you've heard about the butterfly technique
Mm-mm.
trending on social media. It's kind of used with taping the lip and using a combination of both filler and a neuromodulator like Botox. I don't do this, but I am finding it interesting. I'll have to
Very cool. Yeah, I'm gonna have to try that out.
follow up on that
Yeah,
one.
exactly. Do a little more digging first and then see. Tell me a little bit about aftercare. Like what must you know when you're getting lip filler?
Yes, some things to know. The most important thing I like to educate my clients on is the complication risk.
Yes.
So I want to make sure that they're aware of things to look out for and have my number handy 24/7 so that I'm readily available to help them with any potential complications. So compression of an artery, blanching of the skin where it's like turning white and looking like blood flow isn't getting to the tissue and it's not pink anymore. Bruising that's severe or very tender, things that we would be able to address here in the office to
Mhm.
help them with that.
Yeah.
But basic things, I tell them to sleep elevated to help with swelling,
Mhm.
ice for the first 24 to 48 hours intermittently. Definitely clean hands when they're touching their mouth, just for infection risk. I also recommend to my clients to really also have practice good oral hygiene, especially when they're healing, mouthwash, brushing their teeth, things like that. Um, I recommend that they do skip straws for a while so that they're not pursing their lips. Hot food, meaning temperature and or spicy, hot drinks, just kind of all the things we do
Keep you from
go
burning
over.
yourself.
Yeah,
Yeah.
for sure, for sure.
That's no fun. Awesome.
Sometimes we'll use like arnica, a
Mhm.
homeopathic anti-bruising to help with swelling. There's so many things that we can do after care. Some people have a lot of swelling and they need to take like an antihistamine or a famotidine or Pepsid to help with that histamine reaction for the swelling.
Yeah.
They can take Tylenol. Um, if they were to have an infection, we can prescribe them an antibiotic, or if swelling were severe, we could prescribe them prednisone and have them
Mhm.
take that to
Yeah.
help with those things afterwards.
Yeah. Yeah, that's awesome. Thank you for that. Tell me a little bit like, okay, so someone who is maybe like, "Oh, I don't know if lip filler's my jam. Like, how's it gonna look on me? What are there other ways that I can get kind of a similar result where I maybe get that little pouty lip, but not have the lip filler?" And
Yes.
and there's some ways that you can do that. Do tell.
For sure. So a lot of people do a neuromodulator or a neurotoxin like Botox or Jeuveau instead of lip filler, in addition to lip filler,
Mhm.
or before it. It's their gateway drug.
Right? Yeah. And they're like, "Just give me the lip filler."
Yeah.
Yeah.
So any brand of the neuromodulator does relax the muscle fibers around the lip, which is the it's a circular muscle, the orbicularis oris muscle. I always explain it to my clients that it kind of works like a drawstring purse or a pouch. So the muscle typically is pulled tight like the purse is closed, and then when we add that neuromodulator to it or the Botox to it, it opens it up, and that helps to relax that muscle around the mouth, causing it to evert or heighten a little bit. So hence the term lip flip. It kind of flips it out, and that gives clients oftentimes a little peek into what lip filler could potentially do for them. And sometimes we do it a few weeks after lip filler if they would like just even a little more projection.
Mhm.
So
Yeah, that is wonderful.
yeah, a lot of things that go along with the flip is there's some side effects. So
Yeah. Definitely some things to know,
you
right?
either love it or you hate it.
Yeah. Yeah. Yep.
Yeah. So some people have a hard time like swishing their mouthwash
Yeah.
around or sucking out of a straw.
Mhm. If you're a flute player,
Oh yeah, for
not your
sure.
thing.
That's not
Yeah.
your jam,
No.
saxophone.
No. Mm-mm. No, pursing the lips is a little
Right,
challenging. Yeah.
right.
Yeah.
Something that's important with that though is it works better in the younger clientele.
Yeah.
So when we're maturing, it actually can be more of a negative outcome with that lip flip. It either isn't very effective or it causes kind of like a flappy,
Mm.
and people have a hard time and they're like,
Yeah, I don't
make some
like it.
sound
Yeah.
effects here.
Mhm. Yeah.
So you really want to be careful and educate them on what the potential outcomes would be and make sure that they're aware so they don't kind of freak
Yeah.
out and text you, what is wrong with my lips? They're
Right?
not working.
Yeah. I can't move them. Yes, yes. So many wonderful things to know about lip filler. So I so appreciate you coming on and sharing your amazing knowledge, Tina. If you are listening, we would love for you to like, share, subscribe, give us a review. We definitely need some love. We're new at this, and we so appreciate you, our listeners. And we look forward to seeing you on another Beyond the Mirror.
Bye.
We want to make a quick but important disclosure. The information and advice shared in this podcast are intended to provide general knowledge and understanding about wellness and health-related subjects. They are not intended to replace professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified health provider with any questions that you may have regarding a medical condition or treatment, and before undertaking a new health regimen. Remember, your health is your responsibility, and it's always best to consult with a healthcare professional.